Welcome back to another lecture from CyberMD. Thanks for tuning in. In this lecture, we'll be discussing ST elevations and ST depressions on an EKG, two important markers of heart disease and very testable topics on both the USMLE STEP 1 exam, preclinical exams, and clinical clerkship exams. ST elevations on an EKG indicate injury to the heart muscle. This is because the electrical signal in the heart is disrupted, causing a change in the baseline pattern on the EKG tracing. Specifically, the electrical signal is elevated above the baseline, creating a characteristic spike on the EKG tracing. It is important to realize that an ST elevation represents transmural or full wall thickness of the myocardium and represents myocardial ischemia with regards to the myocardium. Again, it is very important to realize that an ST elevation represents transmural, full wall thickness myocardial ischemia with regards to the myocardium. The location and height of the ST elevation can provide important information about the type and location of the heart injury. Remember from our lead view lecture that leads 1 and AVL look at the lateral portion of the heart, leads 2, 3, and AVF look at the inferior and posterior portions of the heart, while leads V1 through V4 look at the anterior and septal portions of the heart. Lastly, V5 and V6 look at the apical portions of the heart. The exact location of the ST elevation is important in determining the location of the heart muscle that has been damaged or is at risk for permanent damage. The underlying etiology of ST elevations can be related to acute myocardial infarction, also known as a heart attack. In a heart attack, the blood flow to the heart is disrupted, typically due to a blockage in a coronary artery. This can lead to cellular damage and subsequent death of the heart muscle cells. Other causes of ST elevations can include pericarditis, which is inflammation of the tissue surrounding the heart, myocarditis, which is inflammation of the heart muscle, and certain types of heart muscle disease, such as dilated cardiomyopathy. Now, ST depressions on an EKG also indicate ischemia. In this case, the electrical signal is depressed below the baseline, creating a characteristic scooping appearance on the EKG tracing. Similar to ST elevations, the location and depth of the ST depression can provide important diagnostic information about the type and location of the ischemia. ST depression, unlike ST elevations, is representative of myocardial ischemia that is not transmural, but rather is only partial thickness with regards to the myocardium. The underlying etiology of ST depressions can be related to coronary artery disease, where the blood flow to the heart is limited due to the buildup of plaque in the coronary arteries. This can lead to a decrease in oxygen supply to the heart muscle, causing the ischemia. Other causes of ST depressions can include anemia, where there is a decrease in the number of red blood cells, as well as hypotension, which is low blood pressure, both of which may lead to low oxygen delivery. It is important to accurately diagnose ST elevations and ST depressions on an EKG to determine the underlying cause and the appropriate management. Treatment options may include medications such as aspirin or beta blockers, lifestyle modifications such as exercise and a healthy diet, and in severe cases, revascularization procedures such as angioplasty or coronary artery bypass surgery. These treatments aim to restore blood flow to the heart muscle and prevent further damage. In conclusion, ST elevations and ST depressions on an EKG are important markers of heart disease and can provide important information about the type and location of heart injury or ischemia. Accurate diagnosis and quick management is essential in preventing further damage to the myocardium. Thanks for tuning in, and please be sure to like, comment, and subscribe to our content so that we can continue to provide free medical education resources to students around the world.